Welcome everyone to Healthy Mom and Baby Innovation Competition 2.0. I'm Dr. Michael Muro, the Chief Academic Research Officer at Parkview Health Systems. I have several hats that I wear. Number one, being a clinician and working at Parkview for many years, but also serve as past chair of the Board of Trustees at Indiana University, still serve Indiana University and am my clinical professor of medicine there teaching medical students. Well, today we had an incredible day with innovators around the world to try to bring solutions to one of the biggest pressing public health problems, not only in the United States, but worldwide, and that's maternal fetal mortality. And so we are very blessed. I just wanted to give you a little background of our center here. This center, we've been conducting clinical research trials to try to bring new therapies to patients for 30 years. And several years ago, we decided that we needed to do more to support our patients and support our mission of advancing patient care in Indiana. And to that end, we initiated an advanced simulation center in order to retrain clinicians and improve the care throughout our health system. That subsequently expanded to touch our region well beyond our own health system. But probably just as important to that is we needed innovation around healthcare and to bring new products and solutions to our patients. That's not only products, but also process and process improvement. And so there's an incredible team that has been built around that. Many of you may have met some of the team members, you will today. And that is really advanced patient care in our region. All of the innovators that we had today were bringing new solutions to the problem of maternal fetal mortality. And that is one of the biggest problems that the state of Indiana has been facing. And many of the barriers to overcome that were addressed today. So I want to thank all the participants today, particularly for their participation. And we're so excited to work with these innovators. Whether they win the competition or not, they are all incredibly talented and worthy of significant support. So thank you. And thank you for tuning in to the summary here this afternoon. Thank you.
Yeah, and as you may know, this competition is put on in conjunction with Matter Health out of Chicago. So now I'm pleased to introduce Stephen Collins.
Well, thanks so much, Ethel, and thanks, Dr. Muro. It's been really a pleasure over the last few years getting to know both of you and your whole team and all the work that you've put into making Parkview such a leader when it comes to health innovation. So Matter, for those of you who aren't familiar with what we do, we're a healthcare technology incubator and innovation hub that's built on a core premise that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. And so as a result of that, we live for programs like this one, where we can work closely with an innovative health system like Parkview and with innovative, like cutting edge entrepreneurs to create collaborations to facilitate the development and the deployment of solutions that can improve health in meaningful ways. At Matter, we are all about accelerating the pace of change of healthcare. And one of the core things we do is incubate startups. Since we launched about 6 years ago, we've worked with more than 650 companies. They range from very early to growth stage startups. And we have a suite of services to help them grow at every step along the way. Our member companies have raised more than $2 billion to fuel their growth, and their solutions have benefited more than 300 million people around the world so far. We also work with large organizations like health systems, also life sciences companies and payers to help them build their innovation capacity. We help them source and co-develop solutions and gain insights into the minds of their patients and the dynamics of the industry. And we have training capabilities to help them also develop their internal innovation muscles. And then finally, we serve as a nexus for people who are passionate about healthcare innovation. We bring people together to be inspired and learn and connect with each other. And we produce a lot of programs, including large-scale events for the broader community, as well as small forums that are just for our members. Today, this is the second iteration of the Healthy Mom and Baby Innovation Competition that we've run together with Parkview Health. Last year, we received more than 60 applications from companies working to reduce infant mortality rates. And Parkview is now working with 3 of them today. This year, we received more than 50 applications from companies focused on reducing maternal mortality. And according to a recent report from the Commonwealth Fund, the US has the highest maternal mortality rate among 11 developed countries. And underrepresented mothers, mothers of color, mothers with lower socioeconomic status, mothers with high school education or less are, of course, dying at disproportionately high rates. So these numbers are what called Parkview to action, and we are just so proud to be working with you, with the Parkview team, on sourcing solutions and ideas to help at-risk mothers. Big thanks to the team from Parkview, who's been really instrumental in the planning and the execution of this challenge. Ethel in particular, as well as Charlotte Gabbard, who we've worked very closely with. Also, thanks to all the judges of this year's innovation competition from Parkview, also from Indiana University, from Healthier Moms and Babies, from Mommy, from Healthbox, who spent their morning listening to pitches from these amazing 8 semi-finalists and asking really thought-provoking questions. In just a moment, we're going to hear quick 2-minute pitches from the 8 semi-finalists. But first, I'm going to pass it back to Ethel Massing, who's the Innovation Project Specialist at Parkview and who's really been the driving force behind this, this innovation competition. So Ethel, I will turn it back to you. Thanks so much.
Thanks so much, Stephen. Thanks for joining us today. And thank you for sending us your amazing team. We really couldn't pull off this competition without a partner like Matter. They do so much work with our teams and so much work behind the scenes to make this competition the success that it is. And we definitely truly relish that partnership. So as Stephen said, I am Ethel Massing. I'm the Innovation Project Specialist here at Parkview Health. I'm also the past president for the HIMSS Indiana chapter, which is the Health Information Management Systems Society. So one of my primary responsibilities here at the Miro Center is to run this innovation competition series. And I jokingly say, for the Healthy Mom and Baby competition, this is my baby. I want to start just by thanking the sponsors and those of you who donated through the Eventbrite app. You really help to make programs like this one possible and really help us continue to do the work that we do with our entrepreneurs. So this innovation competition series is a 1-year cycle of 3 connected events. So the competition series is focused on a health crisis that's faced by our residents. So first, we start with the Datapalooza. And if you don't know, we had that last fall, again virtually, and that's a data analysis competition. And the goal of that Datapalooza is to drill down to the real issue causing our health crisis, in this case, maternal mortality. So this started back in 2017 when HIMSS Indiana held a competition with some of the first publicly available de-identified Medicaid data. And so I was just really thrilled when Parkview decided to partner with us and not only take on that competition, but develop it something into so much bigger and something so much more impactful. So from the Datapalooza, we take those insights that we learn and we turn them into the challenge statements to be solved during the innovation competition. And that's the competition that you're watching today. Finally, those moving on from the innovation competition will be seeking partnerships and investment during the pitch competition in December, and we hope you'll join us for that as well. Just so you know where we go with this competition, we really do this to make an impact in the space. And so one of our teams from last year, Stephen said we're doing 3 pilots. So one of them is our own sleep simulation team from our Parkview simulation lab, and they had developed a safe sleep product. And really, when they came to the competition last year, they had a small 3D model and an idea. They didn't have a business. They didn't have a business plan or a distribution plan. And you can see John and Lisa here. They're already making impact in this space. This is the first delivery of their product. So they came last year with an idea, and now they actually have a business, a company, and product that they're sending out to deliver to really make a difference in this space. And so we're just so excited for them, and so excited for all of these companies that we get to work with, like Candlelit Therapy and Therapy from last year. So this year, we decided to focus on maternal mortality. As you know, in the first Healthy Mom and Baby competition, we really focused on infant mortality because that's what Governor Holcomb set out as a goal, is that we reduce the infant mortality rate by 2024. But as we were looking at the challenge, we really thought, you know, the thing that makes the biggest difference to infants is the health of the mothers. And if you look at the health of our Indiana mothers, you know, our infant mortality rate was bad, but unfortunately our maternal mortality rate is much worse. Right now, Indiana is ranked 3rd worst in the nation for our maternal mortality rate. It is less safe to have a baby here than places like Turkmenistan. It's just not acceptable. So we really want to find ways to help reduce that maternal mortality, especially for our underrepresented mothers. So that was our challenge for this year. How can we better support our at-risk pregnant moms through their healthcare journey? This was a global challenge. And as again, Stephen said, we had 50 submissions from 9 different countries this year and 16 different states. So just so you know what will happen after this, the winner and competitors chosen from this competition. So the winner of this competition and up to 5 other companies will be chosen for an accelerator, and that will happen from October to December. And what happens during that time, they receive mentorship from Matter, where they get subject matter experts and help with running their business. And then they also get to meet with subject matter experts here at Parkview as well. So last year we had teams meeting with physicians, nurses, specialists in labor and delivery, purchasing teams, biomedical engineers, information services, anything that they need to figure out how they can get into and assist in the hospital space. We can't do this alone, so we had a panel of fabulous judges today. Our own Kathy Detweiler from Parkview, Melissa Hanna from Mommy, Leslie Hill from the NIC, Dr. Leach, who is a retired OBGYN from Parkview, Dr. Alton New, who's an anesthesiologist and owns his own company, Initech Custom Solutions, Dr. Mira, of course, Jason Whitney from IU Ventures, Callie Patel from HealthBox, and Paige Wilkins from Healthier Moms and Babies. So thank you to them who gave up their day today to hear these fabulous pitches. So moving right on, I want to get into our top 8 semifinalists. So again, the judges' scores have been tallied, and you'll soon know who's walking away with that $10,000 prize. However, there is still one more surprise up for grab. So at the conclusion of these mini pitches, we're going to send out an audience poll to let you vote for your favorite innovation, and that team will win a special surprise. So without further ado, we are going to start with Giovio from India.
Hello everyone, myself Senthil Kumar. I'm a co-founder and CEO of Giovio Healthcare. We are all so lucky that our mom delivered us very safely because she done all the recommended antenatal checkup. But this is not the same case for a mother living in a remote places, because every antenatal checkup, we need to travel minimum 10 to 15 kilometers, and he has to wait in the hospital for at least 3 to 5 hours just to get a 3 minutes consulting. Due to that, lot of mothers, basically if they have any risk pattern, but they will say, okay, I will go for a checkup in next month. Due to that, lot of mothers delaying their checkup, and that leads to have a maternal death and infant death. To solve this problem, at GeoVio, we have come up with a home-based medical solution where the mother could be able to do a checkup in their home. But current telemedicine solution, the biggest problem is when you are talking to the doctor in a call, if a doctor want to know your ECG or your blood pressure in a live call, we don't have any method. To solve this, what we have done is we built this wearable device. It's culturally designed. Interestingly, it has a sensor inside. So the pregnant mother can wear this device, and it has more than 6 months battery life. So what this device will do is it continuously track her activities, all other parameters, and store it inside. And this is the medical device called Allotracoda we have built. In a single device, when they are talking to the doctor, you just need to hold the device for 30 seconds. This device can measure more than 6 vital parameters in a single device, which is ECG, blood pressure, their saturation, body temperature, and then blood sugar. All these parameters digitally captured, and in a live call, it will be sent to the doctor. So based on that, the doctor's feedback can be shared with their family members. So using this integrated solution, we could ensure that every month, every mom get their antenatal checkup in their home, and any high-risk mother can be identified and consult with doctor at early stage. At Save Mom, we have deployed this solution in India, remote part of the villages, and we have provided more than 33,000 pregnant mothers with our technology. We could be able to provide a home-based antenatal checkup for them, and we drastically reduced the maternal mortality rates in this tribal region. Thank you so much.
Thank you. All right, next up is Surgical from Galway, Ireland.
Good afternoon from Galway, Ireland. My name is Barry McCann, and I'm the CEO of Surgical, an award-winning startup that's dedicated to innovating in women's health. We're pitching here today because we've developed the patent-pending Stericion C-section retractor, a device that will make cesarean delivery a safer surgery for mom and baby. C-section is the most common major surgery in the world, accounting for 29 million births each year. However, new mums are at higher risk of hemorrhage, infection, and even death when undergoing a C-section as opposed to a vaginal birth. On your screen, you can see 4 images that briefly outline the unmet need that we are tackling. The problem is multifaceted, but it starts with a lack of innovation in obstetrics and no specific tools tailored for C-sections. This leads to poor visibility and access during surgery, resulting in the need for additional staff and extra hands in the incision. Ultimately, most recent studies have found that a C-section has an 80% increased risk of complication for either the mother or the infant. We also know that complication rates are higher for women of color and women with a higher BMI. Stericion is the first self-retaining retractor specifically designed for C-sections. By holding back abdominal tissue, it improves access and visualization to the uterus, enabling the clinician to safely deliver the baby, identify bleeds, and prevent prolonged complications. Our company is led by a founding team with over 50 years combined experience. And within the next 12 months, Surgical will be establishing our US office ahead of gaining FDA clearance. We believe that a partnership with Parkview Health could be the springboard required to get Stericion to market faster, enabling us to support the amazing obstetricians all over the world by making C-sections a safer surgery. Thank you.
Thank you so much. Next up, we have Nurture VR from Behavior.
Hi, I'm Alexandra from Behavior. Our headquarters are actually in Nashville, Tennessee, but we'll take Michigan as well. Just to give you a little bit of background on the problem that we're trying to solve, perinatal mood and anxiety disorder, also known as PMADS, is one of the most common complications of childbirth in the US. It actually affects about 14% of the women in their lifetimes and up to 50% in some specific populations. PMADs can lead to a variety of adverse outcomes for both the mothers and their babies. Some of those can include poor breastfeeding rates, poor maternal-infant bonding, poor infant immunization rates. But most importantly, it also can lead to maternal suicides that account for up to 20% of postpartum deaths. So at Behavior, we have created a 22-week maternal mental health program that's really designed to liberate expectant moms from stress, anxiety, and fear that's associated with pregnancy. By using the power of virtual reality, we put moms in this immersive environment so that they can experience a calming world where their parasympathetic nervous system is activated, which reduces stress. And all 4 learning centers of their brain are engaged, which provides a memorable learning experience. Nurture VR really focuses in 3 phases: the prenatal care, which teaches moms healthy practices during pregnancy and helping them prepare for labor and breastfeeding. We also have the labor and delivery, where we offer pain distraction therapy and breathing guidance. And then ultimately, there's the postpartum care, where we're supporting the mother-baby bonding, implementing stress reduction, and ultimately reminding moms how to care for themselves and their relationships. So we're striving to make a difference in providing moms of all socioeconomic status the opportunity to get support necessary for their health and the delivery of their baby. So through our partnerships with Save Moms and Cherish Moms, we're donating a portion of our proceeds, and we're also giving our users the opportunity to donate their headsets after use so that we can really impact mothers across all socioeconomic status. We ask for your help to scale this support and to reduce maternal mortality exponentially. Thank you.
Up now from Ypsilanti, Michigan is Liquid Gold Concept.
Thank you so much. Good afternoon, everyone. My name is Anna Sadovnikova. I'm the CEO of Liquid Gold Concept, and we specialize in clinical lactation training for all health professionals to improve maternal health outcomes. And we're doing this because of all of those mothers out there with cracked, bleeding nipples and babies that are fussy at the breast who come to the pediatrician and the pediatrician says, I'm so sorry, I'm going to have to refer you to the OBGYN because I don't deal with breast issues. I just do pediatric medicine. And then the mom gets to the OBGYN and the OBGYN says, I'm so sorry, I can't help you with your infant feeding issue. Go see the pediatrician. In our society, our physicians and nurses, they're not trained in breastfeeding management. And we rely on lactation experts. And these lactation experts, well, I'm one of them. I'm a board certified lactation consultant. And when I got my certificate, I was horrified because nobody ever verified my clinical competence in lactation support. And so it's no surprise that 75% of all mothers, not just in the United States, but abroad, fail to breastfeed successfully. And this is a big problem because breastfeeding is really important for the health of the newborn and the mother. At Liquid Gold Concept, we're poised to change this. We use simulation technology to train all health professionals across the spectrum of different health fields in clinical lactation, and we can verify their clinical competence. Think CPR dummies, but for breastfeeding education. We manufacture the world's most realistic breastfeeding, newborn, and breast health simulators in one of 4 skin tones to ensure clinical and cultural competencies are met. We then incorporate these simulators into telehealth practice sessions for healthcare professionals. We have actors who we train to portray different pregnant and lactating patients, and they wear our breastfeeding simulator in a skin tone that matches their own. They can have pains, aches, all of that. They can cry, and our health professionals are able to engage, practice their clinical lactation skills. We can verify their clinical competence. And with your support, we can scale this solution so that every single mother and baby receives timely and skilled lactation support from our healthcare team. Thank you.
Great, thank you. Next up, we have Stream from Fort Wayne, Indiana.
Hi, I'm Jack Patton. As a male founder, and like many others, I have a personal experience that motivates me to help improve maternal care. While more than 700 women die each year from pregnancy-related complications in the US, Black women are 3 times more likely to die in childbirth than white women, even though pregnancy-related deaths in the US are largely preventable, like in Indiana, where that number is 87%. And implicit biases are silently contributing to these outcomes. According to social science and medicine, implicit bias does have some consequences, not the least of which are strained patient-provider relationships and clinical outcomes. So much so that A1 released a statement in June, which reads, maternity care providers should be aware of the effect of possible implicit bias and racism on their language and actions. And unfortunately, common and current implicit bias training is simply ineffective for many reasons, especially for underrepresented mothers, until now. That's because Stream's platform helps healthcare leaders improve patient satisfaction scores and health outcomes by reducing the effects that implicit biases have on communication and decision-making while maintaining strict ethical boundaries. Stream's platform rapidly deploys snackable, individualized, and confidential experiences that enable large groups of participants to learn in a safe space in just a few minutes a day. So take a physician who learns about 16 of their own implicit biases by taking implicit association tests directly in Stream's app. When every test is complete, a micro video is delivered based on their specific result. The physician receives small yet highly relevant portions of learning throughout their busy schedule. And finally, curriculum goals are given to track every day for the physician to apply knowledge, build habits, and reflect on their decisions, all while healthcare leaders improve efficiency and effectiveness and receive actionable insights to proactively engage hospital employees. This is what Stream could do with a Parkview pilot to shine a light on deeply personal and pervasive blind spots, especially in maternal care. Thanks for the opportunity to participate.
Next up, we have Bleed ID from Orlando Health.
Hi there, I'm Michael Schmidt with Bleed ID. In the United States, it's still too dangerous for many mothers to give birth. Postpartum hemorrhage is the leading cause of maternal mortality globally. In the US alone, like we've heard here today several times, 700 mothers die each year from pregnancy-related complications. And despite the advances in OB care, the leading cause of these deaths remains postpartum hemorrhage. Experts and studies agree that the majority of these are preventable. During C-sections, unrecognized blood loss and delayed recognition of a postpartum hemorrhage can dramatically complicate a C-section and lead to significant downstream impacts on patient outcomes and the cost of care. Vaginal blood loss is often difficult to recognize during these procedures because it's hidden underneath the surgical drape. Introducing Bleed ID, which exists to keep mothers safer, healthier, and alive during and after a C-section delivery. Bleed ID is a system of technology and products created by high-risk childbirth specialists at Winnie Palmer Hospital for Women and Babies to support clinicians during the C-section delivery and post-op process. Our system includes a redesigned C-section surgical drape to visualize any vaginal bleeding that might occur during the delivery, and a set of devices to collect and quantify the blood loss experienced by the patient under the drape. By providing these real-time tools in the OR that recognize and quantify blood loss, we're preventing postpartum hemorrhages by alerting the care team to intervene before the bleeding becomes uncontrolled. Our products directly replace items currently used in the OR and easily fit into the workflow used by the surgical team. By using Bleed ID's products, delivery hospitals can perform C-sections with greater confidence that they can recognize bleeding and intervene sooner to keep their patients safe and healthy. Thank you.
Thank you so much. Next up is Mamone from Brooklyn, New York.
Hi, my name's Nini Fan. I am a microbiome researcher and the founder and CEO of Mamone. Mamone is a biotech company aiming to reduce maternal fetal mortality and increase healthcare equality by providing early identification of high-risk pregnancies. We are currently focused on gestational diabetes, but will in the future also address other complications, such as preeclampsia, that when detected early could be prevented. Gestational diabetes is one of the most significant pregnancy complications with a staggering cost in both dollars and quality of life for both mother and child. GD increases infant risk of preterm birth, even stillbirth. Mothers who develop GD are more likely to develop type 2 diabetes and their infants as well. Gestational diabetes also disproportionately affects parents of color and other high-risk populations. Sadly, there is currently no predictive test, and current gestational diabetes test is done too late to prevent disease development. In fact, gestational diabetes must be developed to be found using current testing standards. Mamone offers an easy, at-home, completely non-invasive solution. Using metagenomic technology, we test the microbiome and identify potential high-risk patients months before current testing. Our platform provides supports, nutritional information, and other resources that all have been developed with access to care as a prime object. By keeping our most precious yet most vulnerable families at the center of everything we do, Maman will be part of the solution and reduce maternal fetal mortality. Thank you.
And last but not least, Maternal 911, Ithaca, Michigan.
Thank
Oh my
you. Did you know if you're pregnant in California, a woman there has a risk of dying of 4 per 100,000? That same pregnant woman, if she moves to Indiana, her risk there is 43 per 100,000, 10 times the risk just by moving states. If she has color of skin as the woman in the picture, her risk is 2 to 3 times her white counterpart. Shelley and I bring over 5 decades of experience for pregnant women right there at the bedside in the trenches, and we recognize the tremendous need for this safety program. So Maternal 911 was birthed.
OB deserts are popping up across the nation. EMS providers are with pregnant women for much longer periods of time. ERs are seeing pregnant women at higher rates, and some of the hospitals don't provide services for pregnant women. Obstetric departments have to keep healthcare professionals up to date using evidence-based practice. This program provides knowledge and includes simulations to help gain knowledge, be put into action, and identify gaps in the individual as well as the healthcare team.
Our program has ease of use for the learner from novice skills and renders on all devices 24/7 access at a time that's convenient for the learner. The learner can resume where they left off or start at the beginning of the module.
Maternal 911 has a vision that women of the world achieve the highest standards of healthcare throughout their lives and wants to help women get the care they need when they need it. Using this safety program, healthcare providers get accurate, reliable, and current evidence-based information that can result in prompt, safe, quality healthcare delivery. Early recognition will save lives and reduce healthcare costs. This program can be used to support the at-risk, pregnant, and new mothers throughout their pregnancy journey, as well as many aspects of their daily lives.
So partnering with Parkview and Matter, we know Maternal 911 is confident that the education available to providers will improve outcomes. Parkview Health can assist Maternal 911 by providing expertise to improve the user experience, provide assistance with research, and many other opportunities that could not be achieved as easily on our own, because we know teamwork is the dream work. When you have a family member and you take them in for healthcare, they're pregnant, you believe that team is competent to provide their care. Your loved one's life is in their hands. Our program has the team prepared to provide those services, even when something doesn't go as planned. So thank you for allowing us to participate. And as I said, teamwork is the dream work.
Thank you.
Thank you, ladies. So excited to introduce you to Melissa Hanna. She is an amazing entrepreneur. She has a terrific story, and she was a great judge for us today as well.
Thank you so much for that introduction, Ethel, and thank you very much for having me here today. My name is Melissa Hanna. I am co-founder and CEO of Mommy. My background is in law, business, and policy, and not actually in healthcare. I got overexposure to the world of maternal and infant health through my own mother, who is a board certified lactation consultant, registered nurse, and a master's in nursing education, and has taught many nurses and many mothers over the years about obstetric care and about breastfeeding support. And so I kind of grew up in a world where I knew a little bit too much, a little bit too early on about where babies came from. I never thought that that would affect my career as it has. In fact, I thought early on that the one place I would never go in my career was into maternal and infant health. And that was because I felt like this was really a space that my mother had devoted her career to, 40 years worth of work, actually over 40 years as a nurse. And as one of the first, folks to get the IBCLC when that certification became available in the country many years ago. And so I thought, well, that's my mother's work. I'm going to go do something else. But I always had a passion for social impact and entrepreneurship and finding ways to do good and do well in the world. And so with my interest in public policy and in social impact, entrepreneurship, and technology, I started to pursue education technology as the space where I could start to create solutions that could have a broad impact on students and on education systems across the US. And I worked in several startups over the first decade of my career through college and beyond. And it led me into a law and business joint program for concurrent degrees after finding that it's really hard to do social impact entrepreneurship. Even though there's clear demand, there's clear need out there for things, is tech solutions and business solutions within the spaces of major and I would say highly regulated industries like education, healthcare, personal finance, and really helping people, especially those who have been maybe disadvantaged or more marginalized in these different industries over time, helping to democratize access to these different resources, services, and educational programs. I thought, well, why is this so difficult for entrepreneurs to do who want to do this kind of work in the world? And the decision to go back to grad school and pursue degrees came from the idea that working in social impact entrepreneurship really requires you to be not just tech savvy and good with ideas and good with creating solutions, but also very practical, because it can be the Sisyphusian sort of boulder uphill kind of challenge to work within some of these spaces. I saw that in education technology for many years. And after working to build solutions that were often multi-stakeholder platforms that centered students in the middle of the story and brought together around them all the different players in education that want that student to be successful, whether those are the parents, whether it's school administrators, teachers, counselors, social workers, community-based programs, bringing all these people together into software solutions that centered the student's experience. I started to ask my mother about whether or not there were things like this happening in healthcare. And she kind of threw up her hands and said, oh, we're all dealing with Epic or Cerner or some version of either of those. And we haven't yet gotten to the place, especially within maternal and child health, where we are able to see real impact and real centering of the mother-baby dyad in the story and in the technology and in the data. Even though providers every day do this work on the ground and act in this way, it's not necessarily the case that our tool set and our technology reflects our values and our core mission to actually support this mother-baby dyad. And so immediately I said, Mom, I think we should go build that. And she said, no, go do anything else with your life. Maternal infant healthcare is one of the hardest, most complicated, most fragmented industries to be in. Please go back to ed tech. That's actually easier. And I said, challenge accepted, Mom, because this seems like really a place where there can be there can be a lot of impact and there's a lot of opportunity. And so I'm going to just take you through what it is that I have built over the past, it's been now 7 years, almost 7 years with Mommy, with my team, with my own mother as a co-founder, and my other business partner, who is our chief technology officer, and just take you through that story of creating a maternal and infant health solution and some of the challenges, and then end with some key lessons learned and take some questions from the crowd and just share what I can about working in this space. So what is Mommy? It is an integrated care delivery marketplace for maternal and infant health. We focus on all of those other kinds of professionals outside of your OBGYN and your pediatrician that are often considered allied health professionals, complementary care professionals, other kinds of support and professional support and providers that can be critical to the success of this birthing journey and really instrumental in producing positive health outcomes for mom and baby. And so we've created a space that allows patients to integrate these different types of care providers and these different types of care experiences together, and again, center the mother-baby dyad in this story and make it manageable all from one place. Now, while I'm talking about this from the standpoint of it being a patient experience and a patient solution, you can imagine it's not possible without having amazing providers around the table to build this and design this and create the opportunity for patients to navigate and manage their journey in one space. So that's what I'm going to present to you today, is how we built this into what it is. So first, we certainly don't have to dwell on this. I'm going to go through this pretty quickly because I think this crowd is well aware of the challenges within this space. And we've heard some fabulous presenters here, the teams that have been pitching today on what's wrong with maternity in the US today. We know that it's fragmented and that much of that is rooted in closed IT solutions that have limited interoperability and siloed not just health data, but also healthcare providers from collaborating and working together. We know that it's biased. The numbers do not lie. Systemic racism and structural barriers that have prevented access to care for thousands of families and really millions of patients over time across this birthing journey, from preconception through pregnancy, through postpartum and new parenthood, is detrimental to the entire experience of maternity if you can't necessarily approach it with confidence that you're going to get the care you need when you need it. And then that inaccessibility, well, that's manifested in a lot of different ways, but I want to zero in here on the fact that many essential services are not necessarily covered by insurance. And in other cases, they're covered by insurance, but there's not necessarily enough providers to deliver that care in that market. And so all of these intricacies can really drive up the cost of care and drive up those barriers. And then we end up hearing about maternity stories where someone needed something they may not even known was available to them. And maybe they did know it was available, they couldn't get it in time. And this is happening across the country. So what's the impact? Well, in the United States, healthcare costs billions more than it should. And moms and babies are still dying from preventable causes at rates that are higher than any other developed nation. This is, in many cases, completely preventable. And this is work that my team and I, and through conversation with my mother and many healthcare providers across the country, that, you know, when we started on this course, we spoke with hundreds of healthcare providers to understand what the challenges were, what the complexities were in this field as they each saw it from their different vantage points in this industry. And it became very clear that this was a complex problem that required a comprehensive solution. So when looking at the market, as all of the teams today have had to do, I imagine, to assess what the competition is out there and who else is trying to do something to solve the same kind of problem that you're seeing in the market, I noticed that there are a lot of point solutions. There are a lot of maternity-focused startups that offer a solution either directly and exclusively to consumers, or they're maybe selling something through employers to get to the employees who are pregnant and birthing persons. Founders are often told early on in the startup journey that the actual healthcare industry is something to avoid when you're building in health tech. You know, providers and hospitals and health systems and payers, they're just far too bureaucratic and slow moving to work with. And as an early stage startup that has to go and get to market fast and show that you can make something that people want, you may not have time, or at least you may have been told you don't have time to work with the folks that are really entrenched in and supporting the healthcare industry in the United States. But that's actually where the value lies. And so I found that conventional wisdom of, just sort of steer clear of healthcare and make health tech solutions that other people can have access to that don't require you to engage so much with health systems and payers and hospitals, as an example. I found that conventional wisdom was just that. It's not as easy to apply it in reality, because improving the supply chain of maternal health care is where the lives are saved, where costs are reduced, and where return on investment can be found. We're talking about a $160 billion maternity healthcare industry here. This is the value associated with service delivery alone. This doesn't account for how many strollers are bought every year, and how many onesies are bought, or how many extra parenting classes and mommy and me groups and my gyms someone goes to as part of their new parent experience. This is just the delivery of healthcare in this country. So what we're looking at is a highly fragmented chain, supply chain, you could say, that is complex and expensive. And our company is doing this work of mapping the industry, connecting the dots between everyone to say, let's look at a snapshot of a patient's experience. Who's working on their team? Who's supporting them, even if those providers are not in the same healthcare organizations? And especially so, because that's where cracks are in the system, when providers are actually sharing a patient, but not able to share that data effectively or collaborate on care the way that they would have otherwise wanted to. To build something like this, you also have to apply a lens of health equity, because when you look at these numbers and you see the disparities in care, especially those faced by Black, Hispanic, and Indigenous families in this country, it cannot be denied that some of those gaps in the industry today can be filled and are being filled in key communities across the country by community-based organizations and perinatal health programs that focus on these communities. You can see a few of their logos in a few of their cities here. These are the kinds of organizations that we've brought into the Mommy platform to really bolster this experience and give patients the opportunity to not just link their OB and their pediatrician, but again, link those other critical players that can really have a positive influence on the health outcomes for mom and baby. So what is the Mommy Network? Well, at the core of this, we have a team in-house of technologists, of operators, growth strategists, and support professionals who are clinicians themselves who understand how to use technology for good in this space. And we've built around this whole ecosystem, allied health professionals. You can see here the types of professionals who use Mommy every day to power their practices. For them, Mommy is kind of like an EHR plus CRM toolset so that they can document, chart care, and they can also stay in touch with patients and provide ongoing care coordination. And then on that outer rim here, you see these enterprise organizations. Who finds value in the marketplace we've built? Who finds value in the community we've built? These are the kinds of organizations who come to the Mommy platform to say, we want to improve the quality of care, we want to improve the patient experience, and offer all of these other kinds of services that might have been missing from the equation for us. In many cases, for these enterprise organizations, it's a build versus buy decision. A hospital may be saying, okay, we do inpatient lactation here for the 48-hour stay that you have, but what are we doing around outpatient lactation? What are we doing to ensure that there is an ongoing breastfeeding journey for the patient that wants that? What are we doing around mental health? There may be a social worker that comes by the bedside, again, during the delivery and postpartum recovery window at the hospital, but what are we doing to ensure that that patient gets the social services and their needs met outside of the hospital so that they'll come back in through ER or through ED? So this is the ecosystem that we've built and put all of this in one place for patients to navigate and manage at the same time and in one place. Even during the pandemic, we've seen growth, although you can see here where the surge was earlier this year and how that started to slow the growth. And I think this is really powerful to see how things have really picked up. You can see the monthly user count and how more and more folks are starting to get the hang of what integrated care looks like in maternity, what's possible here. So what is it that we actually made? What's the product? Well, for providers, Mommy is the ultimate perinatal health practice app. It is designed for allied health. You can see here an example of the medical chart. We've created what we call the Dyadic medical chart. We're able to sync with EHRs and health information exchanges, HIEs, and allow reading and writing to that unified mother-baby record. It may come from different places, but in Mommy, what we've done is we've created an interface that surfaces the data in one view. So you can see here medical history, some of the tabs here, flags and monitoring. So if you're tracking blood pressure, you're tracking kick counting, you're tracking mental health using a data-driven model with screenings that are looking at the quantitative data associated with mental health screening, or other things like infant weight over time. You can see those things. And if anything goes into a range, it's going to be a high risk range. It's going to trigger a flag that can then sort of send out a distress signal to the providers who are responsible to tend to that need. Appointments and interactions, we're aggregating this full workup, this full view of where this patient went for care. What does the claims data show? But also, what does the allied health data show? Often, allied health professionals, even if they're using digital charting tools, their charts don't show on the obstetrician's chart or on the pediatrician's chart. So the pediatrician has to ask, have you seen a lactation consultant? Or the OB may say, have you been working with a therapist and getting some emotional support and therapy during this time? But those visit summaries or the record of care, the fact that the instance of care might not have otherwise been visible. Mommy is making that visible for the first time. And then the final tab, care team, is where you can see the satellite sort of imagery of who is working with this patient. Again, that mapping of this industry. I'll show you a little bit more here. We're going to dig in for a second. That virtual care component is critical, especially during the pandemic. We've introduced tools around one-on-one and group video calling in a secure environment so that allied health professionals have tools that are at the same level of quality and HIPAA security as those professionals within the hospital and health system setting have. We also have introduced remote patient monitoring, whether you have a digital blood pressure cuff or you're using a manual solution and you need to be able to enter that data in. I mentioned already mental health tracking. We also do kick count monitoring and fetal movement and infant weight in postpartum. We also provide a virtual nursing program, basically after hours care for your doctor's office, to plug in and say, I may be going home at 5 p.m. But if anything happens on here, the mommy in-house nursing team is going to alert me to that and also be able to provide nurse level triage to you in the event that it's something that can be resolved by a nurse and just made as a note on that account. But if we see something, we are mandated to say something and facilitate that care delivery at the physician level. This technology also allows allied health professionals to automate clinical workflows. For the first time, you have a tool set where you can start to link together the steps of the course of care and follow-up care, building a care plan with articles, with videos, with action items, with forms to fill out, with all the elements of this ongoing care experience, putting in one place. We also have a library of over 300 articles and videos, all translated to Spanish as well, all written at a 7th grade reading level or below for maximum accessibility across the US healthcare market. Here's the mom side of this. Moms get integrated, personalized, and accessible care. Let me just stop here for a second and say that in order to manifest this, you have to measure it. As a company, we are trying to do a lot. We're trying to do a lot of good in the world. We also are a company. We have to actually track our progress and deliver those results, not just to our whole market, but also to our investors that are asking, what are you doing around here? One of the ways we measure this is through objectives and key results, OKRs, that track things like how quickly was a mom able to sign up for Mommy, connect with her providers, add people to her care team, and get care fast. Our goal is to make sure that if you sign up and you connect with organizations within this Mommy marketplace, within this network, you are able to start engaging with and receiving care from a provider that you've connected with within 7 days. Those are the kinds of things that are important to measure in order to be able to perform and deliver on this vision. This is the patient side of the platform. Integration starts with actually surfacing that care team in one place. So when I say integration, I'm not just talking about data porting to different places. I'm talking about the experience of integrated care models. You can see here that there's different kinds of organizations and providers on this patient's care team, and there's some referrals that are pending for her to choose if she wants to link other folks to her care team and share access to her medical record with them. It creates data portability for patients, really true data ownership of your medical record for you and your baby. Personalization. I mentioned the care plan already. Mommy, as a piece of technology, also can automate the delivery of gestation-specific and condition-specific content to your care plan. So once you start to build out your birth plan in Mommy, and you've said things like, you know, I'm not sure if I want an epidural yet, I'd like to learn more about that, we can start to serve that information up from evidence-based resources that we've received and we've cultivated from our partnering organizations, including organizations like the Preeclampsia Foundation, ACOG, AAP, the American Heart Association, to put all of this in one place so that when a patient does have a question or concern, we can very quickly serve that up. Accessibility. Ultimately, we believe at our company that accessibility is the pathway to inclusion. If we want to make something that works for everyone, we have to consider all the different ways that someone might enter into the platform and experience it. Translating things to Spanish and going beyond that to other languages, making things localized. You can see here an example of one of our biggest projects to date, which is with the entire DC Department of Health and Mayor's Office within Washington, DC, to make Mommy available for free and make that after-hours virtual nursing care program available for free to 10,000 Black mothers across the DC metro area. When they sign up for Mommy, they see a localized version of this experience that powers their platform and their dashboard with local resources and recommendations and content that is not just about the general pregnancy experience, but the pregnancy experience within the DC metro area. And so these are the kinds of things we've done to really focus in on what accessibility means within maternal and infant healthcare. Our vision is equitable access to comprehensive maternal and infant healthcare. And I think it's very important here to note the word vision and not mission. Mission is the work you want your company to do in order to achieve a vision, as in the distinction between those two things. If you execute on your mission, what does the world look like on the other side? That's the vision. This is what we want the world to look like: equitable access to comprehensive maternal and infant healthcare. We spend a lot of time thinking about this and asking ourselves, how do we get there? This is the leadership team at the company. The company continues to grow, even during the pandemic, now more remote folks than ever before, but we certainly have seen people come to us from all different walks of life. You can see sort of the logos here, the different kinds of professionals who've joined this organization to work with us. And you can see here the co-founders as well. I mentioned our Chief Technology Officer, Sunny Walia, my co-founder, my business partner, the person who was the first to say, I get what you're trying to do, and I want to join this team and build this with you. And of course, my own mother, who was probably really the first person to say that, but also was the first person to say, this is going to be really hard. Are you sure you want to do this? The three of us jumped in with both feet to build this company. And I think it's a testament to the makeup of the team and the types of professionals who've joined us in this work, that this is something that affects so many different kinds of people in different ways. Many folks within our company know someone personally who has died during or shortly after childbirth. Many folks in our company have struggled with infertility or know someone who has struggled with infertility, have struggled with the kinds of morbidities and injuries that can occur during pregnancy, childbirth, and in postpartum. And you've either experienced those personally or know someone who has and said, not on my watch. I don't want this to happen anymore. These things can be prevented. So I want to just switch gears into a couple of lessons. I'll be quick here and so that we can actually answer some questions if they come up. And to have a conversation about this if interested. But I mentioned the words vision and mission already. So the key lesson here, the first one I want to share, be obsessed with your vision, not your solution. Now, this is something that I learned from a founder friend of mine, someone that I worked with and mentored me when I was working at her ed tech company back in the day. The vision, again, of what this world looks like if you build your thing to the max, if you take this idea, this kernel of an idea you have, and you bring it to life in a way that actually solves the problem you see. It's important to be attached to the vision and not the solution, because inevitably your solution will change. And the only reason why it won't change is if you are so obsessed and so attached to it that you can't stay on guard and ready for the evolutions that occur within the market. If you aren't able to listen actively to what your users, what your customers, and what your partners are suggesting or asking for from you, because you're so attached to the first thing you made or the first idea you had. I can tell you with certainty, what we have today at Mommy is not what I initially thought we were going to have, nor is it what we actually built the first time around. We are on many, many versions in on this software. But importantly, when I talk about what Mommy is today, and I look back at early video pitches of myself at pitch competitions like folks today were in, when I look back at the original pitch decks, which, the design is horrible. I didn't know what I was doing. I didn't have any designer friends, so I had to just kind of do everything myself on PowerPoint. When I look back at those things, the words still resonate. The idea of bringing patients and providers together in a secure and really a secure and safe environment, but also one that is specifically designed for maternal and infant healthcare, that's true today. It's as true as it was when I presented it as the idea for Mommy back in the day. But when investors asked me years ago, well, how are you going to pull that off? I only had like the tendrils, sort of the beginning little spirals of the idea. It needed time to evolve, and it only evolved by bringing something that was a little bit half-baked at the beginning, although we made sure it was HIPAA secure from the beginning, and we made sure that it was top-notch in terms of content and quality of experience. It still didn't have half of the features it has today. But what we brought to the market was just enough to ask people, do you like this? Is it going to work? Do you think it'll meet your needs? And then start to get the feedback, be humble, be open to it, and let people tell you what it is that they want from you. The second lesson, find a way to be comfortable with uncertainty. It ties right into the idea of sort of building and shipping something that isn't the final version of what it is you want to bring to the world, but it is enough to get some feedback. It is very uncomfortable to do this work. I am not going to mince words. I hated this process because for me, I wanted it to be perfect before I showed it to anyone. I wanted to sort of bring this to the world and say, look, ta-da, look at what I made. Look at what my team made. Look, this is my idea come to life. But in reality, it can't be the best version of itself until you invite others into this vision and into working with you. The uncertainty that comes with that, the lag of time in between when you say, I'm going to go do something about this problem, and the other side of it, which is, yay, I made something, look at what I made. That is a very difficult space to be in. It can feel many times like the depths of despair for a founder, wondering if this was all worth it at the end of the day. And I can guarantee you I had those moments, and other people had those moments for me and said, you know, you've got a JD and an MBA, go do something else. Like go work in a health system, go work in a hospital, go work for an insurance company and try and solve this problem from the inside out. And I kept feeling like what it was that I wanted to bring to the market, what it was that I kept hearing people asking for in the market wasn't something that any individual healthcare organization in this space was going to be able to achieve in a reasonable amount of time, because they had their own problems that they were already solving. And so that kept driving me to try and do this. But again, being attached to the vision and not the solution, I would consistently tell myself, almost as a promise at night to myself, Melissa, the day you find someone else or something else that is doing a better job at creating this pathway to that vision of comprehensive care, access to comprehensive support in maternity and pediatrics, the day you find someone else who's doing it, you cede to them, you join forces and you say, what can I do to help bring your vision to life? Because your vision is my vision. And so I always kept that as part of this, was that I was never going to be too attached to my solution that in a way that would encumber me from achieving this vision. And this goes to the third point, know thyself. This is what I tell every new founder, everyone who's just sort of starting on this journey. Self-awareness and humility, and really appreciating who you are, what you bring to the world, and understanding what you don't necessarily bring to the world is critical to success in bringing something that is much bigger than yourself to life. And it starts with building your team. Building the right team means knowing who you are and what you can bring to the team, and accepting who you are not and what you cannot bring to the team, and going out and finding those people and inviting them to participate in building this vision as well. So that is a key thing here. I think this one slide, I could extrapolate on this for an hour. I won't do that today, but it is so critical, especially within the world of healthcare and building solutions within healthcare, because it is a hard road. And I am sure that all the founders who presented today have experienced this personally, the challenges associated with being told, no, that's just not going to work for us, or no, we don't have the money for that right now, or no, we like that idea, but we don't think it's fully fleshed out enough yet, or any of those versions of no. Those are difficult moments, and it can be a point in time where you ask yourself again, like, am I doing the right thing? Should I change course here? It starts with a deep understanding of why you're doing this, what you bring to it, and who you can be in the world in this vision you are, you're seeing ahead of you, as the starting point for building something the right way, but also continuing to have the fortitude and the resilience to build it. So those are my 3 key lessons today. And that's just a snapshot of my story in building Mommy. I will leave my contact information up here, because I invite folks from the audience to write to me, to reach out, founders and other healthcare professionals alike, if you're interested in continuing this conversation. I see that there's a question here, so I am going to answer this from Matt Herman. How do you know your technology-enabled marketplace solution is making an impact? How do you measure ROI? That's a great question, Matt. I mentioned the OKRs being a critical part of how we operate the company. Taking a measurement-based approach is essential in growing a business. It's also essential within healthcare just generally. And so we model a lot of our internal operational performance on the best practices that we've seen and we've learned from our partnering organizations. We work with medical centers that are sort of individual standalone facilities. We work with multifaceted public and private health systems, IDNs, payers, and also individual private practices and allied health professionals across the country. And so a lot of our measurement-based work is really in the vein of how do you measure ROI for healthcare generally. Now, of course, there are patient satisfaction measurements, and for that, we use the NPS model, Net Promoter Score. We invite patients to give feedback on a regular basis about their experience in the platform, the providers they're working with, and also things like groups and classes that they attend, and whether or not they felt like not only did they get their questions answered and they got what they needed from it, but did they feel safe participating? Did they like the crowd? Did they like the provider? Did they feel like this was an ideal virtual experience for them, especially in a time where they may not have other solutions available to them during the pandemic? So Net Promoter Score is a great tool to use for measuring impact as it relates to patient satisfaction. We also use that for provider satisfaction. How are we doing, we ask providers, on building out this ecosystem so that you can better collaborate with your colleagues? I mentioned access to care. We look at access to care in terms of a number of different quantitative measurements. I mentioned the one around speed to care, right? Can we make sure that a patient connects with an organization, finds the provider that they need to be working with on mommy, and then get access to that support very quickly? It doesn't mean everyone gets into the doctor's office within 7 days, but can we create a touch point so that you don't pick up the phone, call the practice, and they say, we'll see you a month from now, and then leave that patient in a moment of despair, as we see so many mothers experiencing across the country right now. So speed is another measurement here. Another measurement is just healthcare outcomes. We are tracking through that medical record, that claims data, the reports directly from patients, right? So patient reported outcomes and provider reported outcomes. What happened? We need to all get better at calculating and tracking what really happened in each of these patient stories. Okay, any other questions? Okay, something just came in. Hugh Jedwell, how do you know that, let's see, how do you know you've had enough of an MVP to launch? Did you use any metric like HXC or intuition or something else? Well, I think intuition is part of the game. You have to know thyself. You have to be able to trust your gut as you're building something, but you cannot go only on intuition here. So intuition can be a good tool, but I think that the way to apply it when you're deciding when to introduce an MVP, which, by the way, for some folks who may not recognize that acronym, a minimally viable product, right? What's the first version of this idea that you have from your head? What's the first version you can bring to real life and show to other people? It doesn't have to be a cool coded app that's in the App Store. It could just be a drawing on paper. It could be a WordPress site that you make and you use WYSIWYG sort of like drag and drop tools to say, hey, this is what it would look like one day. That's what I did with Mommy. Patients couldn't go in there because it wasn't HIPAA secure. The first version of the Mommy app was actually not usable, but it was displayable. I could show it to people and say, this is where you're going to be able to do this. And you can send a message through here and you can see your medical record here. That way I could show it to people and ask them what they think. That is an MVP just as much as the first version of an app in the App Store is, and maybe even more so. As soon as you have something that is, you could think of it as an artifact. It is tangible in some sense where you're not just pitching an idea, but you're saying, this is kind of what I'm thinking it's going to look like. You should start getting feedback from people. If you are waiting for it to feel perfect, you have missed the moment in time in which you should have brought it to the market and asked people for feedback. I have been there before. There are parts of this project that I waited on. And by the time I brought it out there, people said, oh my gosh, I wish you would have told me about this 6 months ago. I had a bunch of ideas. I could have told you about those, but now you tried to do it all yourself. And I have learned the hard way in some cases that I waited too long. And I don't make that mistake anymore because I know that it's better to just show people your idea and see what they have to say about it. Any other questions? Well, I think we might be at time then. Let's see. Oh, okay. No, sorry. Something came in through the chat. 7 days seems reasonable for some issues, but not all. Can there be a variable length of time considering the issue? Yes. So this is a good benchmark for us operationally in whether or not the platform is functioning on the whole in the way that it should, looking across the board at all specialties and all patient needs. So that is what I would call sort of an executive level OKR. It's something that looking through all the data and the performance metrics of the company over the past 12 months, set that OKR for the company and said, this is the standard at which everything needs to meet. Then individually within given programs, mental and behavioral health would be one of those. 7 days is not enough, is not a reasonable amount of time if you have a patient who ranks 21 out of 30 on EDPS. That needs to be tended to right away. And so then within the mental and behavioral program division of Mommy, I worked with the lead directly, who's a fantastic psychologist and has helped us build this program through her work in other health systems over time. She's come to us to build out what, sort of the dream product for mental and behavioral health for women. We had to ask ourselves, well, what would this look like? And how do we really mitigate and reduce the liability? So that overall executive metric may not necessarily apply within mental and behavioral health the way it could apply, for example, in other areas of support. When you're talking about critical patient risk, though, you can't just use measure like speed to care. You have to look at a number of different sort of flags and alarms and different things that are going off to create a model of action that a provider can engage with, and hopefully not create alarm fatigue, or get folks to a point where they think, well, there's all these other people in mommy, someone else will get to that. I don't have to take care of that today. And so that's actually where the virtual nursing after hours program came from. Enough physicians came to us and said, look, I like this idea. I want all my moms to have a mommy account, but I don't have the after hours care here. I can't be sending messages back and forth through the app, and neither can my front desk staff. What do you have in terms of layering a solution for services on top of the digital experience that my moms will have if they sign up for mommy? And it was, again, market need. People came to us and said, what can you do for me in regard to providing some level of nurse clinical oversight on this patient population? There's a lot of care coordinators out there. There's a lot of not home visiting, excuse me. There's a lot of health worker, perinatal support person kind of programs out there. Physicians were asking us for clinical nursing oversight, and that's what we designed. And that came absolutely out of the market feedback. Okay, I think that's it for now. So I'm going to turn this back over to Ethel. Thank you so much for the time today, and thank you for staying tuned.
Hey, Melissa, before you jump off, I do have one more question for you. You were an entrepreneur, much like all of the entrepreneurs that pitched today, starting out. So for all the people watching, how can people help these entrepreneurs? How can we support you all?
Oh, okay. Well, that's a great question. Here, I will stop sharing and just come back to screen here. I think that first and foremost, I've talked now to entrepreneurs directly in this crowd about getting feedback from folks. So the flip side of that is that if you are on the receiving end of a founder's pitch, think about what kind of feedback is reasonable and actionable at the point that they're at right now. I had a lot of people early on, they were not necessarily within the realm of healthcare. That was probably my first mistake. I went to traditional Silicon Valley, who said, okay, great. So how do you get this to 1 million moms? And I said, if we could actually show that we were able to prevent one critical error from occurring, or close the gap in care for one high-risk mother, it would be enough, because it's happening on an individual basis, right? It's not like, well, there were 5 today. There were, but the idea is that they're not all in the same place. So if you can get into spaces where you can provide a solution that even has an impact on one life, it's a start. And I think that a lot of times what I received early on was feedback from folks that wasn't actionable and wasn't reasonable considering the state that the company was in at that time. So I invite everyone to be very thoughtful and curious. Ask founders what their hardest challenge is at that moment in time. My best investors ask me, what are you dealing with today? And they get that is how I'm living, that I'm living in that uncertainty. It may have been a good morning, maybe a rough afternoon. I don't know what's coming. And so someone just in asking me in earnest, what are you dealing with today, is the beginning of a conversation where someone can provide really practical and actionable feedback. So that's my trick. You can start with that question, you can expand it to what are you dealing with this week, but don't ask founders to tell you where the company goes 2 to 3 years from now. We are living for the day. And in many cases, until you get to a few $1 million in financing, our company has raised over $5 million to date, for example. You don't have the kind of escape velocity that gives you the luxury of deciding what this company does 3 years from now. You got to figure out how to make it through the rest of the month.
Great. Thank you so much, Melissa. And we really thank you for joining us today. Thank you for joining us as a judge.
Thank you.
So now the moment you've been waiting for, the winner of the audience poll, they're going to win this lovely, I blurred my background. They are going to win a lovely trophy that you can not quite see here. Sorry about that. And also $500. And so the winner of that audience poll is actually Mamom. So Nini, do you want to, do you want to say anything?
Yeah, I just want to say thank you, everyone, and all my friends, family, and colleagues who supported me through this competition. Yeah, and thank you for you and Gina and then Sam for the rehearsals that's helping. Thank you.
You're welcome. No problem. Thanks, Nini. And now, the person who will be receiving an automatic spot in the accelerator and the pitch competition, mentorship and a 1-year membership to Matter Health, and $10,000 will be newest surgical. Barry, I don't know if you have some words for us.
Wow, that's very unexpected. I was just pretty much kind of sat back and enjoyed all of the other participants' pitch, and it's phenomenal. I mean, there's amazing work going on around the world, and yeah, truly honored and unexpected, but really, really grateful. I think most of all, it's just great validation for what we're doing and for the whole team. Just, I suppose, we've been putting years into this, and to know that experts in the field really value the work that we're doing and see a lot of potential, I think that's what really means the most to us. So yeah, excited for the future, excited to be working with yourselves, and yeah, really looking forward to it. So thank you all so much.
Thanks, Barry. I know we're really looking forward to working with your team, and I think, just that we thought you can make a difference in that maternal mortality space, and that's what put you over the edge. It was a tough decision. So to all the other competitors, know that it was a tough decision. So again, we'll be announcing the rest of the competitors that are moving on to the accelerator soon. So again, you can see our pitch competition coming up on December 15th, 2021. You can follow us on social media. Look for that coming on Eventbrite soon. You can follow more info on our website, and we look forward to seeing you all in the future. Thank you so much to everyone who joined us today. Thank you again to all our competitors. Thank you to Stephen Collins and Matter for all your help in pulling this off. Melissa Hanna for your terrific keynote, and all our other judges today. We hope you have a great afternoon. Be well.